afternoon, everybody, and I want to welcome all of you to this event. Thank you for joining us this afternoon. We've got a short time and we've got over 35 questions that have already been sent by our correspondents. And so the format of this afternoon is for me to pose those questions and for them to be answered by our various panel members. Now, if you've got burning questions, please make a note of them in our chat function. And if there's time at the end, of course, we will try and pick them up and answer them in the best way that we can. Now, the areas that we're going to be exploring today from the questions that you've sent are about handling the effects of COVID-19, public health matters, family, social matters, finance, support and resources for you, stuff about loneliness and some of the worries out there, and perhaps about helping others. And of course, we'll be talking about vaccines today. I start with this. As a church and as a community and as a cohort of Adventist professionals, we offer our condolences for the many people and families who have lost loved ones during this time, and to all of us who have been indeed affected by the coronavirus pandemic. For those of you who may find parts of what is shared upsetting due to these really real life experiences, we're going to provide support information at the end and after our time together this afternoon. There'll be a single document that we call the Resource Bank for You and Yours, and it includes things like resources on mental health and well-being, finances, children, young people and families, as well as a number of resources from the Adventist Church. And that's why we're here today, to be able to share and to help as many as possible through the devastating effects of COVID on health, employment, families, spirit, well-being. Please understand that as you see our panel members, that we're here as part of a community. We're sharing information as NEC representatives, health professionals and advisors, of course, but we're also here as parents or as children ourselves to literal or spiritual parents. We're here as people who may have had direct experience of managing COVID. I'm just going to let you know who those panel members are. Today we've got Denise Roberts, who's a health visitor and a team leader for a health visitor team. Dr. Annette Durant is a GP. Dr. Linda Browne, also a GP with the university. We have Professor Ivan Browne, who's the Director of Public Health for Leicester. We have Dr. Desaline Joseph, who's our Paediatric consultant. Joining us today are Pastor Michael Baker, who's the district pastor for the Leicester District of Adventist Churches. And we're also joined by Dr. Beatrice Kastrati, who's the NEC Health and Possibility Ministries Director. And we move to our first questions about coronavirus and how we handle it. Dr. Joseph, having COVID-19, what's it like in reality? How do we deal with it?
Fortunately, I haven't had COVID-19 myself, but a very close family friend of mine unfortunately did pass away, who's exactly the same age as me. And I've also had a close member of my family develop COVID-19 symptoms. So there are 3 classic symptoms, which Dr. Browne already mentioned. There are lots of additional signs and symptoms that people may develop as a result of having the COVID-19 illness. So in terms of what it's like for someone caring for someone with COVID-19, it actually can be quite stressful from an emotional point of view, a social point of view, and even a physical point of view. The person has to be completely isolated from the rest of the family, which means they need to stay in a room which should be ventilated, so window open, but the main door should be closed. So even when we were delivering food to my dad, we had to leave it at a door and then walk away and not be able to go into him. If anyone was attending to him, we needed to wear a mask ourselves, go in, be there for less than 15 minutes and try at all times to be at least 2 meters away from him, if that at all was possible. If the person who has the COVID symptoms or who has tested positive should be using a separate bathroom and toilet. And if that's not available in the home, then it should be thoroughly cleaned afterwards. And the person cleaning needs to take precautions to try and prevent them from becoming infected themselves. Many of my friends have had COVID-19, and many of them have been frontline workers, nurses working in mental health or working on general medical or surgical wards. They have said that this illness is, if they've been symptomatic, is like nothing they've ever experienced. And they've all said it is not like flu. And many of them have said at the time that they've been unwell, they felt like they were going to die. Some of them have been into hospital and to A&E, but have not needed to stay overnight, but it's still quite a scary disease. From my experience, from caring with someone directly in the same home as me, or others who don't live in my household, psychological support is very important. Calling people, texting them, letting them know that you're thinking about them and letting them have someone to talk to. And also there's practical support, which is very important. You may be able to drop off shopping to their house, or if they're in a different city, you can order shopping online and get it delivered to them. And these things make a big difference and hopefully will help somebody on the route to recovery. And for those of us who have experienced someone actually passing away from COVID-19 or from a condition not related to COVID-19, such as my 14-year-old niece who died at the beginning of the pandemic in March, looking out for each other, sending messages of support and love, that is one of the most critical and important things that we can all be doing right now.
Thank you so much. Thank you for that, Dr. Joseph. Denise Roberts, from a health visitor's point of view, I'm going to ask this question. Can you tell me about some of the measures that you'd recommend to people about either avoiding coronavirus or indeed handling it if you get it?
Okay, hello everybody. In terms of avoiding coronavirus, as health visitors, we do generally promote overall good health. So we encourage people to take a healthy diet, to exercise and make healthy lifestyle choices. That's one thing that we do. As we know, this can help to reduce the occurrence of underlying conditions that can place people more at risk of becoming quite unwell with COVID-19. So we continue to do that. In terms of avoiding it, it's about encouraging the clients that we come into contact with about the government guidelines, washing your hands every 20 minutes, maintaining social distance and wearing a mask in the right places. It's all about good infection control to prevent, contracting coronavirus infection. We already advise pregnant mums and breastfeeding mums, and also for children under 5 who can be deficient in vitamin D, to take vitamin D. And we know that there has been some information about the benefits of vitamin D in protecting and strengthening the immune system. So as health visitors, as we're visiting in homes, we do reiterate the government guidelines to ensure that people are taking the measures that can help them to avoid contracting COVID-19, and also things that will help strengthen them to be less likely to experience the symptoms so severely. And in terms of the services that we offer, a lot of them can be accessed via virtual means. And that means that clients are able to get the services they need to manage their families. They're also able to remain distanced from other people and therefore reduce the risk of contracting COVID-19 through, for example, infant feeding groups that are now online. And there's a lot of services that are available on websites. And also, if people do want to contact health visitors, there is a chat health, it's called chat health texting. So it's really about reiterating the government advice and promoting healthy lifestyle choices amongst our client group.
Lovely, thank you, Denise. I'm just going to, in a sense, reiterate some of the points that you have made there. The question came in that said, I'm a key worker, I've got to go out to work, for which all of us are so grateful. But again, what precautions do you think I could take as I go out every day?
Once again, it's adhering to the government guidelines, and it depends on what key worker role that you're in. I certainly know that in terms of health, if you are a frontline worker, if you're working in the community, if you are wearing a uniform, there is guidance in terms of if you're going to a facility to work, we advise that you don't wear your uniform as you're traveling to work. You change into your work when you get there. Also, as you finish your work, rather than going home on the bus in your uniform, the suggestion or the idea is that you would get changed out of your uniform to get back home. And all these things can help to protect you, your family and others. And this has already been mentioned in terms of the lateral flow tests that are offered to some key workers. Certainly if you're working in the NHS, those lateral flow tests can help to identify whether you are positive so that you can then take measures to protect not just your family, but also the people that you're working for. In your particular employment, your employers rather, may well have particular guidance for you that will help to make sure that you stay safe. As a key worker, you are provided with PPE, personal protective equipment. As a health visiting service, we never used to. We used to wear our own clothes, but now we're wearing uniforms, and we're also using PPE, which helps to protect our clients and ourselves as well. And once again, it's just reiterating the government guidelines in terms of when you are out and about, even in terms of your contacts, still maintaining a safe distance. If we are planning visits to see clients, we make sure that we do screen. We ask questions to find out whether anybody in the household is symptomatic. And if so, we would deliver the service in a different way. So it's asking questions to identify what the situation is in our particular roles to make sure it's safe for us to go in. And like I said, other key workers, there may be directives from your particular employers about what you can do to keep yourself safe and the public also.
Thank you. Thank you very much, Denise. I'm going to Dr. Durant and to Dr. Browne for a very specific couple of questions, which I cannot read. So I'm going to ask Dr. Browne to read the question and both Dr. Durant and Dr. Browne to answer that question. Dr. Browne.
Thank you. Happy to read it for you, Pete. The question in totality says, it's in three parts. Part A says, is the vaccination safe after having a sleeve gastrectomy surgery 6 months ago, whilst it has also put a hindrance on my mobility and physical health? Part B says, is it safe to have the vaccination whilst on the following medication: omeprazole, bisoprolol, atorvastatin, and ferrous fumarate? And the last part C, says, has someone who has got osteoporosis and who's on alendronic acid, is it safe for them to take the vaccine?
Okay, well, good afternoon, everybody. Thank you for attending and listening. So to answer this question, obviously, I don't know who the individual is or the age group that it pertains to. However, is the vaccination safe? So yes, in all the situations described, it is safe. And interestingly, just in yesterday's British Medical Journal, the article, which is based on our report feedback through a yellow card system, to the Medicines and Healthcare Products Regulatory Agency shows that most side effects are mild, and they're in line with other types of vaccinations. So in terms of sore arm, headache, tiredness, and perhaps mild flu-like symptoms. So I hope that's reassuring to the majority of people. And indeed, in terms of more severe, which we would class as the anaphylactic side effects and reactions, they, to date, based on the review, is about 1 to 2 cases per 100,000 doses given. So in terms of vaccination in this particular scenario as well, firstly, above all, I would say well done to each and every individual who is taking responsibility for their underlying health problems and really working hard to get the best control they possibly can. So in the first question or part, it's really good that measures were taken to address obesity, which certainly severe obesity is associated with more severe outcomes from the COVID disease. And as you'll hear later, that particular group is a group which will be offered the vaccine specifically as we go through the vaccination rollout. From the medications that are listed, it would also indicate to all of us here really that there's an underlying long-term condition, and those with underlying long-term conditions, those which were deemed severe, will have actually received shielding letters, which by virtue of that means you will have already been offered the vaccination and deemed safe to receive it. And then later, again, as we go to the under 65 group with the long-term conditions, you also will be invited. And again, this is because you're deemed at higher risk of severe illness should you be infected or acquire the COVID disease. So the conditions which might this particular might actually cover would be those such as if you've got a blood cancer, those who have diabetes, those who have had organ transplants, or indeed are on chemotherapies and immunosuppressants, which reduce your body's own immune system's capability of fighting off infections. Later, I'll probably go into all the others, which would include chest complaints, so those with severe asthma, kidney disease, sickle cell disease, HIV, or indeed on steroids to suppress their immune system, rheumatoid arthritis. So hopefully that gives some reassurance as to whether or not the conditions and the questions posed would be eligible and certainly offered the vaccination.
Thank you, Dr. Durant.
Thanks, Annette. Yeah, and I'll add to that in saying there are very few medications that would make it, not a good idea to have the vaccination. The only ones I would say would be a limitation would be if you're on a particular medication that suppresses your immunity for any reason. So that might be, as Annette said, if you've got a particular type of a cancer or being treated for some sort of rheumatological condition or bowel condition or very bad skin condition, where you may be on something like methotrexate, azathioprine, or some of the biological treatments which are available. It's advised that there's at least a 2-week gap because the vaccine relies on you having a well-functioning immune system to be able to produce the immunity. And these immunosuppressant medicines actually dampen down your immune system. And so if you were to have the vaccine and very soon after that have an immunosuppressant medicine, it would stop the vaccination from working. So the current advice is if you're on an immunosuppressant medicine, which none of the ones on this question are immunosuppressant medicines, then you'd be advised to delay your immunosuppressant medicine by about 2 weeks. So if you have the vaccine today, don't have your immunosuppressant in the next 2 weeks, but that would be something that I would expect you to discuss with your specialist or your GP. If you're on a medication like that, you will definitely be under a specialist. So they would have advised you about that. The other condition where we are not actively vaccinating people is if you come on the day for vaccination and you have a high temperature. So if you present on a day where you're due to have a vaccine and you've already got a high temperature, we would send you back home and say, get a test for COVID. And then once you know that you don't have COVID, you can come back and have your immunisation. So all the medications are listed in this particular question. There's not a problem. The surgery that you had, there's not a problem. The only limitations may be if you present on a day and you've got a fever, or if you're on an immunosuppressant medicine. But pretty much everything.
I have a quick follow-up.
Oh,
Dr. Browne, Dr. Browne, I have a very quick follow-up question here. And somebody has just asked, if someone had a bronchospasm during surgery, is the vaccine safe?
Somebody had bronchospasm during surgery, yes.
Is the vaccine safe?
Yes, yeah. I would treat it very much like a flu vaccine or a travel vaccine. They're all in the similar categories that, you know, there are very few reasons why you wouldn't be able to have it, unless you've actually had a severe allergic reaction to any of the contents of the vaccine. Then obviously you wouldn't be advised to have that particular vaccine. But the good thing about COVID-19 is that there are more than one just vaccine. There's lots of different types and they all have different contents. So if you're allergic to the contents of one, there's every possibility that you could have a different one that doesn't have that particular thing in it.
Thank you, doctors. I'm going to come back to the subject of vaccines a little bit later. At this point, though, I want to look at public health. So here we are in the city of Leicester. And I'm going to ask Professor Browne a couple of questions that have been particularly posed to him. Professor Browne, is there anything that you want to say before I ask you a specific question?
Yeah, what I'll do is I'll just very briefly, because I still want to talk about the city and the people, and that's in the city. I'm really happy for everybody else that's joining us. But really, I just really want to just make sure that we understand where we are as a city and the church family that lives here. So just in terms of overall numbers, and this just to provide you with a bit of context. So in terms of confirmed cases of COVID-19 in the city, because different numbers have been bandied around for a while, but we've had 31,394 cases, confirmed cases of COVID-19, and that takes us up to the 5th of September during the course of the year. So you can see, bearing in mind the size of our city, that's quite a significant number of people that have had COVID within the city. Before Christmas, the rates got really quite high. We reached a point of almost 600 per 100,000 people being positive for COVID, but that's dropped away. And I think we are well below the sort of 200 and the 290 to 280 sort of figure as I speak to you today. But the big impact of that, of course, and there are people that are on here that are working in our hospitals that will tell you that left University Hospitals of Leicester in a really critical position. It wasn't just people on an ITU. They had to expand ITU to almost double the size to try and cope. And this wasn't just Leicester. This was across the country, where there've been huge pressures around the system in relation to that. So it's just to make people aware that this is, you know, nothing past. This is still an active issue for us as a city. We've had a number of deaths that have been COVID related, or at least there's COVID on the certificate that sits around that. We're still in that position where we've got quite high levels of deaths, 633 within that sort of 28-day period. We'll talk about deaths and death certification later on as part of this. But the good news is that, of course, at the moment, We are doing all that we can in terms of the messages that we're giving out, vaccination, testing. There's a whole range of things that we've got across the city now to help meet the challenge that we face. So just a bit of context for us as an area.
Thank you, Professor Browne. Now there's a question that's come from Sister Belgrave that starts like this. This question is for Professor Ivan Browne. So you better answer Auntie's question fine. Sister Belgrave asks, we have been on lockdown since March 2020. Just what is the reason for the delay? Could it be that people are underestimating the crisis situation and continue to carry on business as usual in certain areas? It seems like many are still disregarding the measures to avoid spreading the infection, especially in certain areas. What action can be taken to such areas to get this message across? Okay,
this is an interesting question because I've got my biological mum on and Sister Belgrave, who I always call mum anyway. So I need to answer this really, really quite carefully because I meet mum sometimes on my walk when I'm walking in and she's taking her walk around the park. And I can suspect that that's what she wants to ask me on my walk in. But coming from here, what really happens is that, you know, in some ways we overcomplicate what's happening here. What we have here is a communicable disease. The clue is in the title. We pass it on from one person to another person. And if we're all in isolation, if you were asking me what's the ultimate public health advice that I would give people at this time, even though it's not practical, I would say everybody stay home. Just don't go out because it just stops the transmission. It stops the route of transmission, and that's what I'm trying to do. I'm stopping people passing it on to one to another. Big difference with this and other communicable diseases is that it is very easily transferable. And then we've had the variants, which have become even more transferable in terms of things like the Kent strain, concerns about the South African strains. There's a Brazilian strain that we're also looking at. So those are even more transferable. So that's the key thing. So Mom hits it right when she says, is it that people are not paying attention? Is it that people feel that maybe it won't happen to me, or maybe it doesn't matter for me? Well, it might not matter for you. You might be asymptomatic. It might not affect you, but the issue is you can pass it on to somebody else that it might well affect. So I think we've all seen, pictures of people just carrying on business as usual. You go onto the parks, there's a big event on Spinney Hill Park as if nothing existed. Sometimes you go to parts of the city and it looks like COVID does not exist. In the meantime, we are providing the virus the opportunity to pass from one to the other. What we're very much seeing in Leicester is it seems to be very much linked to inter and intra-home transmission. So you bring it into your house and then you spread it to the family, or you think that auntie down the road is really still part of my household, so you go and visit her anyway, and then that gets passed on to that household and then gets passed on to another household. Very much household driven, far more than it being workplace driven in the city. So yeah, that is absolutely key. Lots of people not paying attention, lots of people thinking it doesn't relate to them, and people are just tired, and I understand that too.
Professor, the question here is, they're saying that young people are becoming affected and infected by coronavirus. Is that true?
This has been a really interesting one. It's been an ongoing one. I keep reminding people that the nature of it being a pandemic, the nature of it being a novel virus means that we are learning as we go along with this, that people do not have all of the answers. So initially what we saw in terms of the first wave, it was particularly amongst the older groups. It was particularly with those with underlying health conditions, all of those kind of conversations. Some of that was about how we measured it, etc. I think that's also part that we have to recognise. One of the things that we've seen, certainly in this new wave, is that we're seeing more young people at least being reported as cases. We're not necessarily seeing the hospitalisations, but I'll talk to Desaline, can come in on that. But what we are seeing is that we are seeing young people that are testing positive. Now, that could be that they're more aware and there's more testing available and people are going and getting those tests. We're setting up tests in schools, so we might be picking up there. Some of our early indications of school testing actually indicates that the prevalence is relatively low here in the city and in other areas. So it's not the main thing, but the big thing about young people is because often they may feel that it's not affecting me, they might be more inclined to go and see their friends and go about their day-to-day activities, collect amongst each other. And the issue there is that you can still pass that on to somebody else. And it might not be you, but in terms of our Christian duty, in terms of our moral duty, we want to be doing things that are not putting other people at risk. So it's not just the case that we might be seeing it and we might be detecting it. The issue is about we might be transmitting it. And that's the message I would like to get across to our young people.
Thank you very much, Professor Browne. I'm going to come back to you in a moment, but Dr. Kastrati, I have a question for you. Dr. Kastrati, what's the picture? What's the impact of coronavirus in the church conference and indeed beyond?
Well, the impact is certainly it's a wide field to answer. Obviously, I do not have access to medical NHS data, and of course, I would never ask for personal medical information of our church members. I can only rely on testimonies and on shared stories. And indeed, I would like to collect some of those because I think it is important to show that this pandemic has affected all of us. It has not passed us by. We have already heard that many of our relatives and friends have been affected. I have just lived in the UK just over a year, and my husband is a pastor here in Manchester, and he was prepared to start as a pastor, doing all the joyful tasks. And so far, he's been only involved in conducting funerals. And of course, this pandemic has affected the church painfully. We have not been able to meet. We have not been able to hug, to share, to be together. This has been so difficult for all of us. It has made worship so difficult. And of course, elderly people, little people have been left behind, and they're very difficult to reach. I can only talk about my own daughter, who is following children's Sabbath school via Zoom and cannot relate to it at all just because she's too little. So the pandemic has affected all of us and is affecting us. And I think it is a harsh reality that we must face. And we can't just think we can pray it away, even though prayer is a great support and a great comfort in this in this terrible situation. And the Lord is there, of course, to protect us, but we also must face reality and must be aware that this is affecting all of us, including our Adventist brothers and sisters.
Thank you, Dr. Kastrati. I'm talking to all of my visitors and all the guests out there as well. We've got a lot to get through, and I'm really hoping that you're going to stay online with us, even though it looks like we only have 30 minutes. There's so much that you can learn, so please stay with us. Dr. Joseph, I have a question for you, and Professor Browne, I'm coming back to you at the very end as well of this section. Dr. Joseph, the question's coming saying, I'm kind of worried that if I have something that requires a doctor or for me to go to hospital, that I should now just avoid those places. Are hospitals and surgeries unsafe?
Thank you, Pauline. So the first message is the NHS is still open. Hospitals are open, GP surgeries are open, and there's been a huge amount of effort to make them safe. So many GP appointments and appointments in outpatients in hospitals are now being offered virtually. So people are being sent links on their phones or by email asking them to join so that they can either be triaged or that complete appointment is being done virtually without someone having to travel. However, if an individual is unwell enough or the complaint that they are presenting with means that they need to be examined directly by a nurse or a doctor, face-to-face appointments are still being offered. So when people come to the hospital, things or the GP surgery, things may look different. There may be directions to only go in one entrance and come out on another entrance. You will see people wearing PPE, so masks, gloves and aprons, and according to which part of the hospital you go to, people may be wearing hazmat suits or having more PPE, especially in intensive care settings. Some care is being affected because we're now in the second big wave and the third national lockdown. So some routine care, which might be surgery and operation that you on a waiting list for, or it might be an outpatient test or assessment, there have been increases in waiting times for those. But if your symptoms are changing, if you feel you're getting worse while you're waiting for something, please let your GP or your doctor in hospital know so that they can review your place on the waiting list and hopefully you can get help sooner. I'm going to talk just a little bit about children. So at the beginning of the pandemic through to the summer, there was a very big concern that parents were not taking babies and children to GPs or to emergency rooms. And we were seeing a lot of children who were turning up much sicker, much more unwell because there had been delays in treatment. So if you're worried, you can make a phone call to 111. Many GP surgeries may still have a different way that you can get in contact with them. And especially if you're a parent and you're worried and you think maybe my child needs to see someone, please do access help. So most children have been we're quite blessed that most children have not had serious illness if they've tested positive for COVID-19. However, there is a condition called PIMS-TS, which is an acronym for a very long name, but essentially it's a condition which we have found has been associated with children who didn't have symptoms of COVID-19, but when they became unwell and they went into hospital and they had a special test called antibody test, they did have antibodies to COVID, which means that they were exposed at some stage. And those children present with very high temperature, and they may have other symptoms like diarrhea, tummy pain, a funny rash, red eyes, cold hands and feet. And we've had in the first part of the pandemic up to 200 children admitted to hospital with this, and unfortunately 2 deaths from PIMS-TS, and it has affected the Black and ethnic minority, especially Afro-Caribbean and African children more proportionately than children from other ethnicities or races. So the key message is, if you are worried about anything, whether it's for yourself, an elderly relative or a young child or baby, please still seek help, because we're here to help you and we're still doing our normal jobs.
Thank you very much, Dr. Joseph. Professor Browne, before I go into the section about vaccines, I'm asking you this question. Do you think, Professor Browne, do you think the government will eventually force people to have to take the vaccine?
I think this is an interesting one. It's been carrying a lot of conversations at the moment. And interestingly, uniquely, I think Leicester is in a really interesting place when it comes to this. Little bit of history, certainly in relation to the original smallpox vaccinations that took place, in last century. Leicester was one of the places that rebelled against that. The whole process of choice and conscientious objection came from the Leicester method, as it were. So I think that, the idea of compulsion is not one that is routine within British society. I'm not saying that it can't happen. I'm saying that it's not one that is routine. So what we are seeing is that I feel that it's probably unlikely that people will take that decision to say everybody must. Places like France, etc., have a history of if you have a child, they have to be vaccinated before they go to school. It is, a normal, but we're not a paper carrying country in that way. However, conversations are taking place now about vaccine passports, not necessarily being driven by the government, but people saying, I'm not going back to work if I don't know the status of such and such, or I'm not getting on a plane if I don't know the status of such and such. So I think there will be some limitations, or there's a possibility that there could be some limitations placed on us whilst we're in this situation in terms of the activities that people might be allowed to do. But we don't know. We don't know. But reading between the lines, it does seem that there seems to be a growing conversation that's happening about returning to work and public transport and some of those areas as well. But, you know, we'll watch and see.
Thank you, Professor. Dr. Kastrati, I'd like to ask you, what is the Seventh Adventist Church's position on the COVID-19 vaccines?
Well, again, I feel so blessed, and I feel so proud to be part of the Adventist Church, which is really, really progressive, especially in terms of health and public health and health promotion, and of course based on the health message. And so we have so many medical schools, least of all Loma Linda, of which I'm again blessed to be an alumnus. So the Adventist Church does place a strong emphasis on health and well-being. So we're very, very blessed to be in this church who encourages responsible vaccination. So we do not have a religious or faith-based reason against vaccinations. Indeed, we have a religious and a faith-based reason for vaccination. Just because it is based on a biblical principle, we are our brother's keepers. We have to act out of love for our neighbors. To be honest, I've stumbled across a interesting passage as I was just researching hand washing in Mark 7, when Jesus was scolded by the Pharisees for that his disciples did not wash their hands before food. And Jesus said, why are we just following empty rules and regulations and not following God's law? And I interpret this as a way of internalizing regulations, internalizing all of those rules that are out there, respecting our neighbor, loving our neighbor, being our brother's keeper, especially in terms of protecting each other by following the advice. And a form of neighborly love, a form of keeping us safe as church members, as brothers and sisters, is to get vaccinated, is to follow the rules, is to stay home, is to wash hands. So I'm proud that we are actually a church that encourages vaccination and encourages all of that immune response that is triggered by vaccination. Why? Because we are a progressive church that relies on evidence-based medicine. Of course, the church is not the conscience of each individual church member, and of course there are individual choices. However, if somebody chooses not to get the vaccine, we must be aware that this is an individual choice and does not represent the church's position. So while there is no dogma or doctrine on vaccination, it is still strongly recommended. And of course, the old advice stands: please contact your health worker, your GP, your local health professional, and talk about this. Ask your concerns. These initiatives, just this panel discussion today, is a wonderful opportunity for everybody to share their concerns and to share their anxiety, because there are doubts, there's lots of misinformation out there. And just opening discussion, having a constructive conversation is helpful. And it is helpful to alleviate all the concerns. But as a church, we do encourage the vaccination, absolutely.
Thank you, Dr. Kastrati. To my GPs, Dr. Durant and Dr. Browne, the question here is, do you think the vaccines are safe? they were tested and approved so quickly. That can't be right.
Yes, thank you, Pauline. Unfortunately, I don't think it's one that can be brief on, because there's quite a lot of information about vaccine safety. There are a lot of people, obviously, because this is quite new, are concerned about it. But I'd just like to give you a bit of a brief overview of what happens with medicines, what happens with vaccines. Any medicine or any vaccine that we use here in this country has to go through a lot of different stages, and at each stage it has to be demonstrated that there is safety. What I'm going to do is just quickly take you through vaccines in particular and how those come to be approved and used. So first of all, the first thing that has to happen is that if there is an illness, the actual infectious organism needs to be identified. That's the starting point of any development of a vaccine. So with COVID-19, thankfully, fairly quickly, the causative organism, the causative virus, was identified. And by Chinese scientists, they were able to very quickly release the genetic code for that particular virus. And that's a starting point then for researchers around the world to then be able to work together. So it's a worldwide collaboration, I would say, in terms of scientific knowledge and techniques which were shared to try and get this thing, as you know, sorted as quickly as possible. It's a pandemic. What pandemic means, it's an infection that crosses all continents across the world. And with COVID-19, while for the vast majority of us, roughly 80%, it's a mild to moderate disease, there's 20% in which it's either quite a very significant disease and could actually end up in death as well. And if you think about it, when you're looking at worldwide population, 20% of the worldwide population is a huge number of people. Even if we just thought about it here in Leicester, 20% of Leicester's population is a huge number of people. And if you have 20% of your population ending up in hospital, that's a significant burden on the health system. So worldwide, there's worldwide collaboration. In a pandemic, it releases a lot of money, a lot of funds to then enable those scientists to do their research. Usually, if you've got a group of scientists working on something, they're working by themselves, they have to apply for funds, they have to apply for ethical, you know, it has to go through ethics committees, and those stages can take many, many years to come through. But with this, because it's a pandemic, funds are available, research is available, and that all is shared very, very quickly. So once you've identified the organism, you decide how you're going to, what vaccine platform you're going to use. AstraZeneca have used like a cold virus basis for their vaccine. Pfizer, Moderna, some others have used just a synthetic lipid base for their, to transfer their vaccine. And then what they do then is they test them in a laboratory setting, first of all, just on cell cultures. And these are human cell cultures, which are used for the testing initially. They look to see how, you know, what responses those cells make. And once they notice that, you know, the cells don't break down, they don't die more quickly, they then move on to animal models. They use quite simple animals, first of all, generally mice. And once safety is demonstrated in mice, remember, mice have a much shorter lifespan than humans. And so you can observe the effects in mice throughout their whole life. So you can see them through their young stages, through their adulthood, through their reproductive stages and death. And you can see whether any of those sections are affected. And if they're not affected, or you know, if there's no significant concerns, you then go on to more complex animal studies like rhesus monkeys, which DNA-wise are quite similar to humans. And so from some of the information you get from studies on these animals, if you're relatively reassured that it appears to be safe, you can then move on to human studies. And we've got various phases of trials in humans. So we start with phase 1, where you use it in a very small group of very healthy adults. So whatever vaccine you've produced, you give to a very small group of just healthy adults so that you can see if their health changes, you can attribute it to the vaccine that you're testing on them rather than the fact that they are generally ill anyway. So you start with very small numbers, very healthy individuals. Once you've determined the safety in those individuals, you can then move on to hundreds of people to work out the dose that you might need to use of that vaccine. And once you've demonstrated what needs to happen there, you then move on to thousands of people. That's phase 3, where you use tens and thousands of people to check your vaccine. And in these groups, you'll test a group, say 10,000 with the active vaccine, and you'll also look at what happens to 10,000 who have not had the vaccine. And you'll compare what happens to the vaccinated group to the non-vaccinated group. And you look over periods of time, but it's sheer numbers which then gives you a wealth of information, because everybody in those trials has to report back what they, anything that's happening to them health-wise has to be reported back. And then the research companies collect all that data, and then they have to submit all that data to the regulatory authorities. In the UK, it's the MHRA, you will have heard that spoken about. That's the Medicine and Healthcare Products Regulatory Authority. And they look at all the scientific information that is submitted from these research companies and say, well, is what they're saying true? From the statistics that they have submitted, is it demonstrating that these vaccines are actually doing what they claim that they're doing? And you've got various bodies which look at all of that data. MHRA, you've got also the Joint Committee of Vaccination and Immunisation, NERVTAG, SAGE, lots of different bodies who are completely independent from the government. Yes, they may receive some government funding, but they work independently from them to look through the data and make sure that all the information coming back is showing that these are safe. And all of that has happened with the COVID-19 vaccines. But what they've done is they've sped up the process, not that they've missed out any of the safety checks, they've run them side by side rather than doing phase 1 first and then waiting for years and doing phase 2 and then waiting for years and doing phase 3. Because of the sheer numbers of people who are dying, there is an urgency to this. And so these have been done side by side, but none of the safety steps have been left out. In phase 3 trials, they use ordinary people who are just willing to be part of a trial. So these are people who may have diabetes, asthma, lung conditions, hypertension, heart disease, on various medications, from different ethnic backgrounds as well. So you'll have people who are Caucasian, Black, African, Chinese, the whole range are involved in phase 3 studies. And so there's lots of information coming back from all of those. And safety doesn't necessarily mean lack of side effects. They're 2 different things. A vaccine can be safe, but it can still give side effects. Right. You understand there's a difference. So very much similar to having a flu vaccine, you'll have it in your arm will be sore for a couple of days. You may get a bit of a fever, you may ache a little bit. It's safe, but it's giving you a few initial side effects. But usually those side effects far, the risk of dying versus a sore arm for a few days, I don't think there's much to choose between the two. So in terms of safety, would I say that they're safe? What's the question? Yes, they're safe. They were approved quickly. Yes, they were approved quickly, but that's because of worldwide collaboration. And can I say that's worldwide collaboration, not worldwide conspiracy?
Okay. Thank you very much, Dr. Browne. I have a few other questions here, and I will come back to Dr. Durant. I'm going to ask you to answer some questions about vulnerable groups. But a few questions that came through that may or may not be able to be answered quite quickly is, which is the best COVID-19 vaccine to take? And how often will we need to take it to be protected?
There are, if we're thinking globally, there are many COVID vaccines which have been researched and are being developed. The answer I'm going to really give pertains to what is available for the UK Leicestershire, where we are based, because this is the choice we have. Now, I can understand that with the varying information whereby the pharmaceutical companies, and I'm going to talk Pfizer, AstraZeneca, the Oxford vaccine, may, on the basis of how they produced it, suggested after 3 weeks we should be revaccinated. And the UK government has taken on a moral, ethical, covering as much of the population as possible so that fewer people are at risk whilst waiting for the initial vaccine, took the initiative of having the 12-week suggested gap. Now, some of you will already be aware that the WHO have come and looked at this, and they are in support and do support the 12-week gap, which we are doing. They back the UK decision. In terms of how often it is, you have your initial and then you'll be followed up 12 weeks, 8 to 12 weeks. In terms of the best vaccine, again, there's all sorts which has gone through, and although I answer this to the best of my knowledge based on the data as it is of this week, and so of this week, the decision has been said about the AstraZeneca vaccine that it is as efficacious. I won't talk the numbers because in some ways they're irrelevant, but it has been said it's as efficacious. And so the main thing really is if you are offered a vaccine, you are more protected than without. So if you take, well, I would support you take the one which you are offered, because ultimately, unless you have severe anaphylactic reactions to the ingredients and the components of these, you're more protected than if you hadn't.
Thank you, Dr. Durant. A question here that was sent to us says, I did research about what are the real ingredients in the vaccines, and I came across the shocking claim that they contain aborted fetal cells. Will you confirm that?
Okay, thanks. Yes, I'll take this one. The short answer is no, the vaccines don't contain fetal cells, but to give a bit more background, I'll just go back a little bit to what I said before about development of vaccines, because there are, at the moment, with the vaccines that we're using in this country, we've got the Oxford AstraZeneca vaccine, and then we've got the Pfizer BioNTech vaccine, and they're made in slightly different ways. So the Oxford AstraZeneca vaccine actually involves using a cold virus to deliver the genetic material that produces the spike on the coronavirus. And the adenovirus itself is produced in a host cell line. So some vaccines, like flu vaccines, for instance, use chicken egg cells to do this. Oxford AstraZeneca use a cell line called HEK293, which are human cell lines. The original cell lines were taken from the kidneys of a fetus in 1973, and those cells have been cloned for many years. And so those cell lines are used in research these days and used in production of vaccine, but they are cloned cells of cells that were taken in the 1970s. So I guess you would have to decide for yourself whether you would still class those cells as being fetal cells or just simply cloned human cells. And the viruses made by these cells are purified so that none of the cell matter is left behind in the actual vaccine. So the cell lines, human cell lines, are used to produce the vaccine, but they are not included in the eventual vaccine that is actually injected into individuals. So that's just the AstraZeneca one. The Pfizer one doesn't contain any, is not produced in cells at all at any stage. That's purely synthetic, lab-based. So they are different.
Thank you, Dr. Browne. Professor Browne, quick question for you. I say that. Once again, if I could ask all of our viewers, and there's a lot of us out here today, to stay with us because we want to talk about family matters, education, finances. So stick with us. It's really worth it. Professor Browne, if someone tests positive for COVID-19, they're symptomatic, they recover, and then sadly they die within 28 days due to injuries sustained in a car accident. Is this counted in the daily COVID-19 death figures? And if so, what's the rationale for that?
Okay, so people might think that, you know, trying to count deaths would be very, very easy. Actually, it's more complicated than you think it is. So what it goes back to a question that's often asked by epidemiologists or anybody else, which is this a case of people dying with COVID, or is this a case of people dying from COVID? And bearing in mind that we don't do, you know, pathology on every person that goes through, we have to take a judgment, just as we do with testing. So I'll pick up the two things together. So for testing, for example, we will see how many, I gave you a quote of how many people tested positive in Leicester over that period. Well, that's likely to be an underestimate, because we'll know there's lots of people that have had COVID but have not had a test, therefore they won't be recorded. So that's, you know, we'll know that. With deaths, the way that it's recorded is that if somebody's had a COVID test and within the past 28 days, and it's recorded on their certificate, that will be counted in the figures. Now, the issue around that is that we can always find the anomaly. So we can find that person who had COVID but then had an accident and did all of that. We will always find that, and we have to just say that that's part of the variation. The rationale is that if you've had a COVID positive test, you know, and you subsequently die of a respiratory condition or you know, within that 28 days, it's likely that COVID may well have played a part. So it's not precise. It's not that, you know, the figures are some kind of cover up. It is the best way that we can estimate the potential impact of COVID on death. But what we really tend to look at more accurately is excess deaths. So we tend to look at, given the last 5 years of deaths, how many deaths would we expect to see in September, October, November, December? And we average that out. And an excess death is, well, we're seeing more of that, more deaths than we would expect. And over the period of COVID, what we've seen is an increased proportion of excess deaths. We've seen more people dying than we would expect to see at this time of year, even with flu, even with the fact that people have been in lockdown for long periods and have not been coming out, even with the fact that people have not gone in to hospital for many other things. What we are now seeing is more deaths happening than we would expect. So that really gives an indication that COVID is having an impact on our communities.
Thank you, Professor Browne. Dr. Durant, just before I come to one of the final questions in this section, Dr. Durant, you made mention before about vulnerable groups in relation to vaccination. So the question is, who's eligible for vaccines, in what kind of order? What sorts of conditions are considered in the vulnerable group categories? Dr. Durant?
So I'll take it in two parts. So in terms of the order, we've been fairly swift in the area in working through. So there would have been those at high risk of catching the disease. And so that would be frontline staff, social care workers, and then the group of those who are most likely to suffer from serious complications or indeed dying from COVID. So that would have been the older adults in care homes. And then we went to we've had the vaccination of the over 80s, those who are over 75, and those who are over 70 years old. And then we come to a group as well, inclusive of those who would be considered extremely vulnerable. Now, those who are extremely vulnerable will have been identified, and to know on a personal level, if you were sort of classed as one of these individuals, you would have received a shielding letter. And that letter would have been about taking higher levels of precaution, often requiring other people to do your shopping. And conditions which that would include were people who had cancer undergoing active chemotherapy, radical radiotherapy, who might have cancers such as myeloma of the bone or the bone marrow, leukemia, lymphoma, those who had solid organ transplants, those who also who were receiving and are receiving medications, immunotherapies, which would suppress your ability to fight the infection. Equally, those having targeted cancer treatments, and those with severe respiratory conditions. And by that, I'm referring to things like cystic fibrosis, severe asthma, severe COPD, in addition to those relatively rarer diseases, which increase the risk of infection. And so sadly for those with conditions which I'd abbreviate to SCID, where you might have a combination of deficiencies which affect your immune system, or sickle cell disease as well. So those would be the extremely vulnerable who would have received shielding letters, but equally certain conversations with GPs will also have identified other people who they will have on a case person by person basis suggested that they should equally be shielded. Now, after that, we come to the over 65s, which some probably will be getting now. And following the over 65s, we'll come to the 50 to 64-year-old age group, where there'll be people who have long-term conditions. And as I mentioned before, these individuals may have diabetes, might be adults with Down syndrome, kidney disease, rheumatoid arthritis, and they also will be invited in as well. So hopefully that does give an idea of who should be expecting an invitation. Mm-hmm.
Thank you, Dr. Durant. Much appreciated. Panel, I'm coming to all of you together in a moment, but Professor Browne, just a question that was posed together, I think I'll put them. It says, why hasn't the Food and Drink Ministry approved the vaccine, or why hasn't the FDA approved the vaccine? Professor Browne?
Okay, so first of all, Dr. Browne spoke earlier about the approval process in the UK is with the MHRA. If this person is speaking about the FDA in terms of America, that's not entirely accurate, because the Moderna vaccine was approved, the Pfizer vaccine was approved. In fact, the Moderna vaccine was approved with a vote of 20-0 with one abstention. It was one of the few things that Trump and Biden actually agreed on. So in relation to that, those have gone through their approval. Those are manufactured in America. So clearly they, just as we did over here with the Oxford vaccine, those are their priority vaccines at the moment.
Thank you, Professor. Here's the million-dollar question for my panel members, posed by a correspondent, but also coming from me. Have you had the vaccine? And if you haven't, will you?
I'm happy to take that question first. So first of all, vaccination programs save lives, and they eliminate, and in some cases they have eradicated diseases. So when we're talking about vaccines now in context of COVID-19, but hundreds of thousands, probably millions of babies and children have been vaccinated every year for a very, very long time, for decades. And so there are some conditions that as a paediatrician I've never seen before and would have to look them up, because hundreds and thousands of mothers and fathers have vaccinated their babies so that we don't see cases of things like polio or many cases of conditions like diphtheria because of vaccination programs that have been done on children and babies. And then the second thing to say is that the individuals who work on vaccine programs, who generally look after children, they have been involved in these COVID-19 vaccine programs. So it's not a group of people in a lab just suddenly thinking, oh, what should we do to adults? Let's do something to them. People who are paediatricians, people who work with babies all the time have been involved in this work. So when we talk about vaccinations of adults, to me, in the past, it's been a bit more straightforward because there's normally only one disease we routinely vaccinate for, which is flu, and lots of us get our flu jabs every year and there's not been an issue. I was skeptical about the speed of the COVID-19 vaccination process. And I was a bit like, you know, is it safe still? Have they tested it properly? But I now have a greater understanding that we are in unprecedented times. We haven't used that word, I think, for the whole program. And this is a global pandemic. And so there's been cooperation with industry, governments, pharma, to try and make us all as safe as possible. So although I was skeptical, as a mother, I have a teenage daughter, I work on frontline. I would like to be around for as long as possible to look after my own child. Also, I have older parents. I have parents-in-law who are very much at risk, and I want to protect them too. And so if I want my mum, who is in her 70s, to be protected, then when the opportunity was given to me, although I did have initial skepticism, I went ahead and I have gotten the vaccine. And I'm proud that I have, and I'm pleased because I feel I'm doing something for my community, for my city. I'm doing something for people that I work with. I've done something I look after disabled children. I would not want to be asymptomatic and pass it on to a disabled child and then they pass away because I didn't get vaccinated. And as Dr. Kastrati said, following the guidance that's been given from the General Conference, I think it's the right thing to do, so I have done it.
Thank you very much, Dr. Joseph. Any other panel members want to respond? Before they do though, could I just let our listeners and our viewers know that we're receiving your questions and we'll try and really insert them as we're going along as well. So thank you so much for your questions. Any of our other panel members?
I haven't had my vaccine. I want my vaccine. But the issue is, and it goes back to the point that Dr. Durant was making, in terms of the priority order, we've got to make sure that we vaccinate those that are at the greatest risk. So for that priority one team, you would need to vaccinate one person, if you vaccinate 20 people, you're probably going to save a life. As you move down the priorities, the numbers get bigger. So if you're over 50, you'd probably have to vaccinate 8,000 people before you would save a life. So I am patiently waiting in terms of my risk profile, even as the Director of Public Health. I'm waiting my turn in line. But when my letter comes, I will be getting my vaccination.
And can I just say as well, given some changes to my particular role, I am more clinical facing now. So as a key worker, I did take the vaccine about 3 or 4 weeks ago, and also taking into consideration my own personal circumstances, it was a decision that I made.
Yes, likewise, because I'm a frontline key worker. I was offered the vaccine and I took it. I had the Pfizer vaccine was offered to me. And similar to what Dr. Joseph said, it's not just for myself, but for my patients that I did it. and also my family members as well. You know, I'd feel dreadful if I caught this at work and then spread it to a vulnerable family member. I'd feel absolutely awful about that. And because the vaccine has been demonstrated to be safe, and we're now at a stage, I just looked at my phone not long ago, that we've had about 15 million people in the country vaccinated now. And all of those people have been advised, if you have any side effects, report it back. And that's all going through something that's called the yellow card system, which is something that is available for any new medicine or treatment. If you use one of these medicines, you have to report back certain after effects so that all the data can continue to be collected. And we are in the phase now of what I would call phase 4 trials, where it's mass vaccination, and we're all now contributing to more information about the vaccine by having it when it's offered. So as a Black woman in particular, I thought it's important that there's evidence on what vaccines do in Black women of my age. So yes, I've had the vaccine. I had the Pfizer one. My arm was sore for about 2 days. I had the slightest headache on the same night of the day that I had it. But apart from that, after the 2 days was up, I was absolutely same as usual.
Thank you very much. I'm going to pose a couple of the questions that have come through from our viewers. If any of my panel members are able to respond. There's a question here that says, could I ask the following? I have a family member who's on immunosuppressants and has other underlying conditions. They're being actively encouraged to take the vaccine, but hearing what was said about them not taking medication for 2 weeks following vaccine, I'm a bit concerned. Do you have any advice?
Yes, I'll respond to that because I was the one that raised that. I would say speak to your GP or speak to your specialist, because they will be able to tell you what is right for your particular situation. I was just given a generalization that with certain immunosuppressants, they may affect your immune system to a degree that might reduce the effectiveness of the vaccine. So you have to get specific advice on your particular situation from your GP or your specialist. Some people on immunosuppressants are on them all of the time. They don't have a break. And so your specialist will tell you whether or not you need to have a break if you have the vaccine. There are some people who just have like an intravenous solution of an immunosuppressant once every few months or once every 3 months, or an immunosuppressant tablet once every few months. So you would have to speak to your specialist or your specialist nurse to give you individual advice on what you should be doing.
Thank you. Thank you very much. I see Michelle James's hand raised. Michelle, could you just unmute for a moment there and just pose, because then I'm coming to you, Dr. Kastrati, with just a suggestion. Michelle?
Yes, that was my question. My son is on daily immunosuppressants following a kidney transplant, and you know, it's really concerning with this situation. I do hear what you're saying, but it's actually one of his specialists who, well, both of it is renal specialists and hematology specialists who are actively encouraging this vaccine, for him to have the vaccine. So it really is very concerning.
Thank you, Michelle.
So if the specialist has encouraged you to have it, then I would say go ahead and have it. Because if the person, was your son has had a transplant, yeah, that does put him in a very high risk category for complications.
And he's got other comorbidities as well. So
yeah, absolutely. So, and that would make him very much at risk if he was to catch COVID. And so even if having, even if the vaccine only gives you, because he's on the immunosuppressant, 25% protection, it's better than no protection at all. So I would say definitely go ahead and
would it be advisable? Would it be advisable then for the other family members also to be vaccinated for his protection as well?
No, not necessarily. Not necessarily. He's the one that needs the protection. And as long as the rest of you are following the public health guidelines of hands, face and space, you'll be protecting him by doing that. If any of you as family members are in priority groups as well, you'll be offered it when it comes to your turn, if you're in any of the groups 1 to 9. And we're still waiting to hear from the government what they're doing with the rest of the community, rest of the population, after we've finished vaccinating groups 1 to 9.
In the final cohort, those who actually, adults who are caring and provide regular care to an elderly or disabled person will be offered. So as long as your GP is aware of whether or not you are regarded as a regular carer, that also would mean you would be invited, just to make that clear too.
Thank you, Dr. Durant. Very quick one here, which says, are we allowed to choose which vaccine we want? I want the one that is able to cover me from the South African variant.
I would say at the moment, while vaccine supplies are limited, I would say if you're offered any vaccine, just take it, because if you're offered it, you're in a high risk group. Maybe this time next year, when there's a lot more supply and there's a lot more variation of vaccines, you might be more likely to have a choice. But the thing about these vaccines at the moment is that at the moment, the most prevalent strain in the UK is the Kent variation, and the vaccines are still proven to be effective against the Kent variant. We have got a little bit of South Africa, and again, I'll let Ivan talk about this. But the good thing about the current vaccines that we have is that they're easily tweakable, and they've advised us that by the autumn time, that it's quite likely that all the vaccines then will have effectiveness against the South African variant and whatever other variants may come up as well. So for me, the message is, even if it only protects you 50%, 50% protection is better than none. And what we mean by 50, I mean, the vaccines at the moment, 75% for Pfizer, up to 95%, I think. What that means is if 100 people are given the vaccine, and if they're exposed to it, we'd expect 75 not to catch COVID-19, and 25, even though they've had the vaccine, might still catch COVID, but would expect their illness to be a lot less severe. They shouldn't end up in hospital, and they certainly shouldn't die. That's some of the data that we've had back, is that people have been vaccinated. I'm not aware of any that, if they've been vaccinated and it's more than 3 weeks after their vaccination, then they are very well protected from actually catching COVID. With any vaccination, there's a delay between actually having the vaccine and your body actually building up enough immunity to protect you from the illness that you've been vaccinated against. Very similar to flu vaccines. I've heard people say, oh yes, I had the flu vaccine, but I still had flu. That's possible for 2 reasons. One, you may catch it because you catch flu within that time period directly after having the vaccine, up to about 3 weeks before you're adequately protected with enough immunity. And the other reason is no vaccine is 100% effective in absolutely everybody. So there will still be a very small group of us who may not build full immunity, but will still be protected from very serious disease.
Thank you very much, Dr. Browne. I'm very mindful that the time is getting away, and I really do wanted to get through some of these questions here. If you have questions, I see, for instance, Elder Lowe has his hand up. Please put the questions into the chat, and we'll try and pick those up. But I need to hold on to Pastor Baker right now. If I could, I'd give him the virtual hug, but I have a number of questions that I need him to answer before he has to go off to his next meeting. So if you're patient with me, let me ask this question of Pastor Baker. Says, I can't cope. I can't see a way through this. I hear of mass employment, unemployment, closure of schools and the recession. Is there help to help me re-educate myself or deal with the children who are missing school? How can I keep my spiritual connection alive as I try my best to rely on God's direction? Pastor Baker, a thought from you here?
Okay, and I apologize that I do have to leave in a few minutes, but let me kind of collect my thoughts and put it into a verse that I found particularly helpful, that comes from Isaiah 26 and verse 13, which says, "Thou wilt keep him in perfect peace, whose mind is stayed on thee," that is God, "because he trusteth in thee." So what does it mean to trust? One of the things I found quite helpful through this whole process is to recognize that the God whom I serve, the God who I've come to know, can deal with every single emotion that I have. Trust doesn't mean you don't feel. Trust means you know where to go when you feel whatever you really feel. So there are days where you feel okay, you can cope. There are days when you don't feel you can cope. Where do I go? The same God in every situation. Some people think that to admit that you are uncertain about some things, it means you don't have enough faith. Well, not necessarily. We all struggle as human beings. That's part of who we are. And therefore, I bring to this situation every day this opportunity to dialogue. See, that's the thing. As they often say, it's good to talk.
Yeah.
And so part of making it through is talking to God, having a regular appointment, morning, noon, evening, wherever, but make it regular. In fact, regularity is an important factor in making it through this situation, whether we talk about spiritual issues or, where in my other hat, educational issues. You know, if you have regular times for doing things in your home, for worship, for study, for devotion, for schooling, that regularity helps us all. It's one of the reasons I believe God gave us a Sabbath. Regularity. He knows how to spread us up. So don't be afraid to admit and to share with God, first of all, but also with other human beings who you trust, who will not look down on you because you are having an issue at that current moment. Talk to God, talk to other trusted individuals. The final thing I would say is, and this reflects the discussion we've had, please understand that what we're sharing here is to enable you to use the mind that God has given you to make a choice that is your choice. If you as an individual decide, as the best of all that we've been discussed, that you do not feel comfortable taking the vaccine, for instance, you're still my friend. You're still my friend. I still love you. If you decide on the basis of everything, you decide to take the vaccine, you should not have to feel ashamed and have to hide that fact in the corner that Pastor Baker's going to think, oh, look, at lack of faith. No. You use the mind that God has given you. So you come back to that text. You stay your mind on God because he's going to get us all through the situation. That's what I totally believe. Because I trust in him. Don't always understand. Don't always know all the answers, but I trust him to get us through together. So keep listening, keep asking your questions. It's good to talk. Talk to God, talk to your GP, talk to your friends, talk to your family, but let's keep trusting the best instincts that we have. And I'm so privileged to have all of these medical minds who have allowed me, with my humble brain, a few moments. May God bless you as you continue to discuss. If I can, I'll pop back in a little later and see if you're still going. But it's been very informative, and may God bless all of you.
Thank you. Pastor, I thank you so much. I thank you for that time. And he's made a reference to the time, folks. There's 85 of us here and nobody looks like they're going anywhere. So we are going to plow through until it's just me and my husband on the board. So thank you very much for sticking with us. All right. I want us to talk a little bit about family, social matters. So I have some questions here. I'm hoping that you're sticking with us. And once again, thank you for the questions that are coming through as well. So the question that I've got here is for Dr. Joseph, actually, as I look at family. I'm worried that young people in my household are desperate to get out and mingle. I don't know who that is possibly coming from, probably my house. What do you advise? What do you advise, Dr. Joseph?
Thank you. So I could have posed that own question to myself because I have a young person who lives in my own household who's desperate to get out. So the first thing that I'd mention is that if any of us are ever unclear as to what are the regulations about going out and mixing, check the government website .gov.uk or check Leicester City Council's website or go onto the NHS website. The BBC has good information also. At the time of this recording, the UK is currently in a national lockdown, so the rules are actually much simpler, but we know when we come out of the lockdown that may change if we go back into a tier system, or the government may have a different plan as to how they're going to manage the issue about social distancing. The key thing is, the reason why we're being asked to stay at home is to break the chain of transmission. As Professor Browne mentioned, this is a communicable disease. So it's not something like asthma, which I might have because I have a genetic predisposition to being asthmatic. This disease is something that I can pass on to somebody else. And although young people haven't been getting very unwell and needing lots of hospital admissions, unfortunately, not lots of deaths from COVID-19, there are younger people. I think in hospitals, the demographics of people in intensive care are getting younger and younger. And also, a young person may be asymptomatic. They may go out with their mates. They might catch it from another friend, and then they may go home and pass it on to a vulnerable person. So what I would say is currently, at the time of this recording, all of us should be staying home and only be traveling for essentials if we can't work within the home, if we're going out for food or we're supporting someone who's vulnerable. Currently, we're allowed to go out with one person who we don't live with to exercise, but we have to try and stay 2 meters apart and wear a mask. I would say to our young people, get creative right now. You can use Zoom or House Party, I've been told is an app. I don't know if it's church board approved, where you can meet your friends. Try and keep a routine. The more routine you had, as Pastor Baker said, the better it is for your own mental health and well-being. There are some websites, there's one called The Mix, or there are other websites that have ideas about what to do during the pandemic. You could do a TikTok challenge once it's a kosher one, get lots of exercise, go out, start keeping a journal, make a playlist of certain music, ring your cousins in other countries who maybe you don't know them too well, do a family tree, start working out and doing exercise. I haven't done that myself yet. And just try and be creative. We know this is a time of uncertainty. Exams have been cancelled. We're not sure exactly how they're going to roll forward through to the summer. And we know that young people will have other things like relationships, boyfriends, girlfriends, just general being a teenager. But would say, please stick to the rules. Please get enough sleep. Please stick to your routine. Please try and do your schoolwork because it's still important, and we're all in this together and we will get to the end of this. So that's my general advice.
Thank you. Thank you so much, Dr. Joseph. I'm going to come to Denise now. Denise, this actually is a question from a young person. They've said, I don't feel I want to upset my parents and I don't want to share this with them, but I feel like my life is shattered. I have no control and I won't be able to get genuine GCSE qualifications. Who can I talk to?
Yes, thanks, Pauline. So as a teenager, things can feel quite strange as changes occur in your body en route to becoming an adult. And this pandemic has undoubtedly brought another layer of change. So we've got lockdown, there are school closures, there can be feelings of isolation, people not being able to meet with their friends, as Desaline has said, as they have before. Routine schooling and learning has all been interrupted. It's a really unsettling time. And during this time, one particular survey has showed that young people are more than twice as likely to experience loneliness during this time than older members of our society, the 55 pluses, for example. And being able to communicate worries and concerns and their fears and being able to unburden is really important to give space to be able to cope. But it's really important for young people to remember that they're not on their own. There is hope and there is support. So this young person doesn't want to upset their parents. Now, generally, despite what parents are going through, they may be going through a lot, they do want to make sure that you are okay. So I would definitely consider letting them know how you're feeling. But I know the reality is that some children and young people don't feel that they can discuss matters that are troubling them with their family, and that's due to a whole range of challenging circumstances. But perhaps maybe you can communicate with maybe a trusted family member or a responsible friend. It could be somebody in your community, your church, it could be a Sabbath school teacher, Pathfinder leader, maybe your pastor if you do attend church. And also, it's worth remembering that even though schools are closed, you do have a school nurse. There are school nurses who are really interested in making sure that you're well in every possible way, and they can be contacted. In Leicester, we have a service called Chat Health, and it's a texting service for young people aged 11 to 19. So you can text Monday to Friday between 9 and 5, and the school nurse will respond. And this provides an opportunity for you to talk about your concerns, and they can give you information on things that will help, and also direct you to any other sources of support. So use the Chat Text Health service, which the number may go in the group or it will be on the resource list.
Yes.
If the moderators could check, you could put the text details in the chat. We also have supportive websites. There are some that are run by charities specifically that help children and young people to talk and express. We've got childline.org.uk. The number for that is 0800 11 11. And you know, there are websites that give a whole range of coping strategies for managing stresses and supporting mental health. Youngminds.org is a really good one. So don't keep it to yourself. Talk, access support in a variety of ranges, a variety of methods, including texting, using websites. And in relation to your GCSE, you're not sure whether that's going to be genuine. Communicate with your school tutor. I know schools have pastoral support. I'm not sure how active they are during this time, but once again, you can contact your school nurse and they can put you in touch.
Thank you very much, Denise. There's a number of organisations that Denise has just referred to, which you will find when we send it out afterwards. It's all in our resource pack. All those links and all of those resources are there available to you as well. So we're hoping that you'll be able to access and use those for yourselves. Professor Browne, I've got one for you. I've got one for you. Sounds like a young people's question again. I want to go on holiday. I want to go in July of 2021 and I've pre-booked the tickets already. Do you think I should reconsider travel plans this year?
We all need hope. you know, and you know, our whole background is around the blessed hope. So we've always got to be thinking ahead, and so I don't blame them for doing that, to thinking of a time that's beyond this. And actually, mentally, it's really important to be thinking of a world beyond this place. I too think about that. So how do you protect yourself against that? So first of all, fine to be thinking about a holiday, but if you're not in that place, you want to make sure you're not in a place where mentally you are broken by the fact that your holiday doesn't come off. So part of it's about the attitude that we go into it. You know, if it's a bit more speculative, and I hope, and wouldn't it be nice to, and I want to be on the first plane out of town, that's a healthy place. If you're in a place where you're thinking, if I don't get to go on holiday in June, it's desperate, that's not, probably you better not doing that. There are a number of places that are offering places that are, you know, COVID guarantees in case you can't go, that they will reimburse you. A huge amount of this also, there's a saying that's out there that, you know, we can't be safe until everybody's safe. So if you're planning to travel somewhere, it also depends on what's happening over there. They may not allow you to travel to that place either. So there's a lot of uncertainty around that. But if we're in a position where perhaps you're stifling your ambition somewhat, and you're thinking of somewhere where I might be able to go locally as things ease over the summer, then that's a really positive thing. But don't book with the assumption that you're definitely going to be able to fly, that the world is your oyster at this moment.
Thank you very much, Professor Browne. Dr. Kastrati, parents and children struggling together. Do you have any thoughts or advice about that real struggle of homeworking and homeschooling?
Well, it is a struggle, and I can tell from my own experience. I'm working at home, and also I have to look after a 5-year-old at the same time. So the meetings are sometimes that I have online that are sometimes very funny, you know, because she will always check in on how we're doing. It is definitely a struggle, and of course, you know, there's plenty of advice out there what can be done. What my advice is short and sweet: do what works. Okay. Whether you adhere to a schedule or whether you are unable to make your child to adhere to a schedule at all, don't worry. This is a situation that is unusual for everybody. This is not normal. And I think pretending that this is normal is not helpful. So we just need to embrace what is given us. We need to embrace our children, probably not be too strict on them, but just to choose our battles and choose the battles that we can win. When I talk about my 5-year-old who's trying to get through reception somehow online, and I can tell you honestly, it is not working that well. But to be honest, for me, the priority is that this child is loved, and that this child knows that whatever happens, we're there. So I think the message here, that the ultimate advice is here, do what works. Make sure that you share your love and not your impatience or your irritation. And don't pretend that this is normal, but adhere to a structure if it helps. And ask for kindness from your employer, ask for patience with everybody in your household, and just make sure that love never fails and that love never ends in your house, because this is how we all get through this together.
Thank you very much, Dr. Kastrati. That's wonderful. Okay, panel, I think that I'm going to try and take some of the questions that have come through in the chat. I think I will just start with, let me ask this one of Dr. Browne. The question about diabetes, it says, my mom's diabetic. She feels guilty when people make her feel that she shouldn't have the COVID vaccine. She's really desperate. Oh, this is from a very young person. She's desperate to see my grandparents and not pass on COVID to them. Should she feel guilty? Is there information on vaccine if you have health problems?
Thanks for that question, because I think there'll be a lot of people who are in very similar situations. Quick answer, no, you shouldn't feel guilty. I think every single individual has to make an assessment of what their own situation is. First of all, their own health situation, but also what's right for their family. So as a diabetic, you will fall into one of those priority groups where it's deemed that you are at more risk of complications if you were to catch COVID-19. So you would be offered the vaccine, and so you have to assess your situation, decide whether or not you're going to take it. If you're asking my advice, I would say yes, it'd be sensible to take it, because it will help to protect you and it will help to protect your family. And when more of us are vaccinated, we're hoping that this will enable us to get back to the lives that we've been previously living, where we're able to have more normal social interactions. We're all starving our starved of having our normal social interactions at the moment. Something has to change to get us back to that point. And until we have either treatments for COVID-19, or until we're all protected against it, or until we've all developed immunity to it, we won't get back to that point as well. So something has to change. And for you as a diabetic, I would say it'd be sensible to have a vaccine. Don't let anybody make you feel guilty about it at all. Beforehand, I spoke about the trials that these vaccines go through, and in phase 3, there will have been a lot of diabetic patients in that phase 3 testing that have had the COVID vaccines as part of research. And we've had all the information and are still continuing to get data coming back from groups which have had it. And so far, there hasn't been any indication that having diabetes puts you more at risk of a problem due to the vaccine itself. But there is a lot of information to suggest that a diabetic getting COVID-19 is likely to experience lots of problems. So I would say don't feel guilty. You do what is right for you and your family.
Thank you, Dr. Browne. I'm going to pick up some of these questions that have come through as we've been on session today. So there's a question here that says, I'm due to have my Pfizer vaccine this week. What are the side effects of these?
In the main, as we touched on before, the majority of people just may experience very mild side effects, and that might be the same as with any other vaccine, really. Might have a sore arm, you might feel a bit mild flu-like symptoms, equally a bit of a headache or a temperature, and that in the main, for the majority, is the side effects they experience, and just be prepared for them.
Thank you very much, Dr. Durant. Comment in the chat says the Oxford AstraZeneca vaccine has been shown not to be effective on the new South African strain, whilst the Pfizer one has been shown to be effective. That's a comment that's there. I don't know if anybody wants to respond or just to note that there are other views. Question, how do we dispel vaccine hesitancy in our own Black and Asian minority ethnic and church communities? How can we dispel that vaccine hesitancy? Oh, and is it safe to get vaccines from non-nursing healthcare professionals such as pharmacists?
So just in relation to vaccine hesitancy, I think that what we're doing here is just trying to remind people that, look, there are reliable information sources out there. Just make sure that you're using them. I've often said that there are 2 viruses that are happening at the moment: COVID, which we're fighting, but also social media and disinformation, which we're also fighting. So if I said to somebody the other day, if somebody shares something with you on social media and says, please look at this before they take it down, generally that's a red flag. Just make sure that you're looking at from reliable sources. We talk about that, don't we? We say, go back to the word, go back and find out, go back and look. And when we say look, don't go back and look in social media or what somebody says. There have been so many stories and indications of things, and frustratingly targeting our communities, I would argue. And I find that really difficult, because we've been in a position where, in terms of the differential impact on our communities in that first phase, bearing in mind, the jobs that we do and our living conditions, etc., we found that Black people were disproportionately being affected by the virus. So it breaks my heart, and that's the reason why I'm on here. It breaks my heart when we should be at the front of trying to get our protection, that many people are, rushing ahead, and we ourselves are in the background here. So just use information, get the information you can, really sensible sites. You don't have to go to the original paper. It's great if you can. That's wonderful if you're scientifically minded. But there's lots of stuff on the BBC. There's lots of stuff on NHS sites that are designed to do that. Even on our local authority site, and on our CCG site, Clinical Commissioning Group site. For Leicester, they've got information that's available to you. And as we said all the way through this, make your choices from there. Make your decisions from an informed place.
This is exactly what we're doing here. We're helping people to make an informed choice. We have to be aware that we are the light that we should not hide. We're the city on the hill. We're supposed to shine it and to help our community and to help them stay safe and stay healthy. Now, based on that, I want to say, look at your fellow church members. Every church has a fellow health professional there. We are, as a church, so blessed to be full of health professionals of the highest level. There are nurses, there are pharmacists, there are GPs, there's Professor Ivan Browne there. Everybody is there to provide information. And who else can you trust if not your own brothers and sisters in your church? So I would say, please uphold and empower your fellow church members who are health professionals. If you have any doubts, any questions at all, we are here for you. We are brothers and sisters, and we are answering the questions, and we will support you in your choice.
Thank you, Dr. Kastrati. Here's a really interesting question. Dr. Joseph.
I was just going to answer the last part of the question regarding who is giving the COVID-19 vaccinations. So there's a very, very careful selection process and a very intensive training program that anyone given the vaccine has to go through. And most people, such as pharmacists, are already used to giving vaccines because they are part of the normal annual flu rollout. So it's something that they're used to doing before. My vaccine was given to me by a dentist. And I said to my husband, oh, why was a dentist giving me? Well, I was like, dentists give needles all the time when they inject you for your dental surgery. So they're quite used to handling this type of thing. So please be reassured the person who's giving you the vaccine has been trained how to do it.
Perfect. Thank you very much. I'll be coming round to your pharmacist husband, actually, to have mine done if possible. Thank you. Good question here. So if I get a vaccine, can I start mixing with other vaccinated people from different homes with no masks? If not, why not? Oh, I just see a load of shaking heads here on my screen. Anybody want to pick that up, please?
Do we let Ivan answer that one?
Yeah, so there are a few things in relation to that. I mean, people always have to remember what vaccines are there to do. People think that they're this kind of, it's allowing the body to respond. You know, we are fearfully and wonderfully made. And what we are basically doing is saying, here is a message of something we don't want. Body, the magic is in our bodies. It's not actually in the vaccine itself. It's just sending the message that you need to protect yourself against this, and our bodies react. Now that takes a bit of time for our antibodies to get up to a level that offers us protection. So, you know, one of the things that we've been mindful of is that some people have been vaccinated and then, immediately gone off and started to live life. We're not at that stage yet. I think people have also recognised that we've mentioned about the first doses that give you protection. There is a booster dose that then happens on top of that to top that up. So you are not, it's not a Superman shield that you're now able to go on. Where we're really trying to do is get the whole of the circulating vaccine down. That's when we're really going to have our wins. When we've got this thing called herd immunity, when we've got this idea, so we stop the circulation because enough of us are protected to stop that vaccine having that opportunity, that virus having that opportunity to pass from one person to the other. That's the place we're trying to get to. And it's not so much just you as the individual. So unfortunately, even though you've been vaccinated, we're still going to be in that place of social distancing and caution for a period yet.
Thank you very much. Oh, coming in thick and fast. Question, is it true, the person says, I've had AstraZeneca. Is it true that you won't be able to conceive after taking the vaccine?
So the answer to that is no, it's not true. There's not been any data that has suggested that any of the vaccines cause problems with reproduction. Remember, I spoke earlier about animal trials and that these have been trialed on animals. And so, for instance, if you take mice, it's been looked at and seen that mice have had the vaccine, they've continued to reproduce as they always would, and there's not been any demonstrated they've had any reduction in their reproductive powers. So with the information that we have to date, no, there is no evidence that this causes any problems with fertility. And remember, yeah, I'll leave it there.
Yeah, and I think the only thing that I would add is with all of these things, one has to think through the mechanisms, the body's mechanisms, and thinking about what would it be in a vaccine that could potentially cause that, and there isn't the sort of mechanism that would lead to that kind of outcome. So just being really sensible about the way that you approach that sort of information.
Thank you very much. Here we go. It's one of those big words again. I feel like I'm going to be challenged. Hydroxychloroquine, supported by vitamin D and zinc, has proved highly effective in studies carried out by Belgian authorities and other authorities around the world. These results have been peer-reviewed and published as an alternative treatment. And would it be prescribed by the medical professionals with us here? And why do you think the apparent bias is towards Pfizer and other manufacturers? Don't ask me to read it again because I don't want to go there.
Say from general principles, Dr. Kastrati mentioned a terminology called evidence-based medicine earlier on in the talk. And in the NHS, we do not have a healthcare system which is heavily tied down to pharma, which is the drug companies. So we get preferential rates. A drug that is sold and bought in America may cost a huge amount of money because of the way the healthcare system works. In the UK, we already have differential rates for many of the medicines that we buy in bulk. So the intensive care consultants, the immunologists, the virologists, and public health teams such as that Professor Browne is part of, they are all looking at evidence. And based on that evidence, they are then making decisions about treatment. We have to remember this is a very fast moving illness, which we had never heard of before 2019, 2020. And so there's huge collaborations of data that's being put together in order to make decisions about which treatments to offer and which drug companies we're getting medicines or vaccines from. I don't have an answer to the specifics about the hydroxychloroquine, but in general, the NHS is working as much as possible with independent evidence bases when we're making our decisions. But Prof might have, or Linda might have something else to add to that.
Yes, I was just starting to type it in the chat, but I can just say what I was going to put there, is that as GPs in the UK, we're only really allowed to prescribe within certain guidelines. So unless there's been a treatment that's been approved by the MHRA, we're not really at liberty to prescribe it. So even though I'm, a well-qualified GP, I can't just singularly decide by myself that I'm going to prescribe hydroxychloroquine to treat COVID because it hasn't been approved or licensed for that purpose in this country. In terms of vitamin D, I would say it's a good idea for us all who are deficient in vitamin D to make sure that we supplement our vitamin D, because there's not a lot of sunshine around at the moment, which is the main source for most of us. So yes, we would need to have supplements, but again, the information with regard to vitamin D in relation to COVID, I think is one that is still under review. I don't think there's been sufficient information yet for the scientific community to say that it's definitely advised, and if you take it, that you wouldn't get COVID. At the moment, you can still get COVID even if you have your full level of vitamin D there. It's not going to stop you from catching COVID. It's not going to protect you against the possible complications of it. But of course, it's a good idea if you're deficient in anything to make sure that you get your supplements so that your body has what it needs to do what it needs to do.
Panel members, I want to thank every single one of you for all of your contributions today. I want to ask Elder Vince to be ready to pray for us to finish. I want to thank all of the viewers who are seeing us. I wish I could ask you to, and you know what, I might ask you to all put on your camera so we can see all the faces. But we're going to come to a close in a moment. What I will ask of my panel members is to say one thing that you want everybody to hold in their hearts and in their minds as we go into the next phase of the week or indeed the pandemic. So my panel members are all going to give their one thing that they want you to stick with you, and then I'm going to ask Elder Vince to give us a prayer. I'm going to finish, I think, with, you know what, you jump in. So panel members, jump in with your one thing that you want people to hold on to.
So I would say stay safe, follow the guidance, and let's keep the faith and have hope.
Somebody quoted and said, we're not all in the same boat, but we're all in the same storm. Some of us are on super yachts and some of us have just one oar. And the point of that is, we're all going through this together. Some of us are in a position to be more helpful to others, and some of us are in need. So I would say communicate with one another, find out how each other's doing, reach out and help somebody. And if you're struggling, reach out and get help, because there's help available.
I would say that I'd just like everybody to remember that a lot of information is publicly available. So, if you just look in the right places, all of the information is there online, certainly in terms of the government information, it's widely available, easy to access. I would say start with the NHS Choices. BBC has got really good information on their websites, the BBC, and remember, stick to places where people have to be held to account for the information that they give to you. That's why I'm saying government websites, BBC, NHS Choices. That information, the people that put information on those sites are held to account. So they have to be able to back up what they put on there. Whereas your WhatsApp messages, which have been forwarded many times, nobody has necessarily been challenged in some of those videos. And so some of the information in there may not be, the type of information that you can safely base your choices on. So be careful where you get your information from and make your choices based on your own situation, not based on what somebody else is trying to get you to do or not to do.
And the big thing is keep your channels of communication open. So there's no trivial or silly question if you are unsure. ask somebody trusted, and as Linda, as the rest of the panel will all say, connect with people and with sites which are accountable, which have your best interest in heart, equally their own best interest in heart, because I assure you, they do not want to put themselves in a situation where they will be held to account if they share things which are wholly inaccurate. And to look after your mental health, please look after your spiritual health, as well as keeping connected. And I think that's what I would share with you today.
Lovely. Thank you very much, Dr. Durant. Professor Browne and then Dr. Kastrati.
Yeah, what I would say is, you know, there are so many parallels with what we go through with this and our Christian journey. You know, so many parallels in terms of, you know, make sure you're following clear information, make sure that you recognize that there is hope, recognize that you're supporting one another. All of these things are a difficult time, but a prime time for us to show what it really means to be a Christian. And I would encourage us to use this opportunity to show what that looks like. You know, the pastor said it so beautifully, I'm going to love you whatever, you know, whatever the choices you make, I'm going to love you because you're my brother and you're my sister. And I come from a point of view of just wanting to share that. We are not through this. So we're not at a point where we can relax, but actually that discipline of just continuing to do the right thing for as long as we can, to look after one another, to make sure we're safe. I'm always going to give you the public health advice around making sure that, you know, you're washing your hands and you're wearing your mask and you do, you know, social distance. I'm going to give you all of that. But most importantly, I want to just say, love your fellow man, you know, and just show it in our actions and the things that we do, because that's all we're trying to do this evening. Some may come in and say, well, I'm not sure they said that, or I'm not sure that I agree with that. That's okay. We are just wanting to come from a place of saying, I love you, you're my brother and sister, this is what I know, this is what I'm going to share with you. It comes from that place. So please understand and take it from that position.
Well, in a time when it's very difficult to stay positive, I want to encourage you to read the most positive book in the Bible, and that is the letter to the Philippians. If that one does not encourage you, then I don't know what can. So I would like to close just with my favorite words ever. That say, do not be anxious about anything, but in every situation, by prayer and petition, with thanksgiving, present your requests to God. And the peace of God, which transcends all understanding, will guard your hearts and your minds in Christ Jesus.
Thank you, Dr. Kastrati. Thank you so much. Thank you to all of the panel members today for all of their contributions. It's been amazing. It really has been. If you're interested in health-based programs here at Leicester Central, you can subscribe. You can subscribe to health.leicestercentral.church. You can see in the chat that link if you'd like to know more about what we do and come and support and be a part of us. Wow, this has been something. I really want everybody to put on their cameras, but I'm not sure that I'm allowed to do that. What I will do though is ask Elder Vincent to pray for us as we disperse.
And to add to what Dr. Kastrati has just said, the Bible also informs us in James chapter 1 verse 5 that if any of us lack wisdom, we should ask of God. And God speaks to his people, and he has assembled the professionals who is associated with our church. We are so happy to have such wonderful people in our church. I am, personally, I know where to go when I have troubles, you know? So with that, I'd just like to thank all the panelists for being with us today and informing us. But at the end of the day, it is our choice. God does not force us to serve him. It's about love and freedom. And I think that's what the panelists have tried to do today, to share with you out of knowledge and wisdom and out of love. And just to reiterate what Pastor and Professor just said, we still love you anyway. So let us pray. Heavenly Father, we give you thanks, O Lord. We thank you for being so kind and loving towards us. So much so, dear Lord, that you've sent your Son to die for us, that whosoever will can come and have eternal life through Jesus. It is a choice that we all have to make. So Father, even as we discuss, as we was shared with the information that we've had today, Lord, help us to choose wisely. Help us, dear Lord, to be our brother's keeper. And help us, dear Lord, to love our neighbor as we love ourselves. So Father, as we leave this platform, I pray, Lord, that you would be with us. Help us, dear Lord, to do all things in pleasing and keeping in your sight. So Father, thank you once again. In Jesus' name I pray. Amen.
Amen. Amen and amen. Once again, thank you, everybody. We'll be sending out our resource bank. We call it our resource bank for you and yours. We'll send that out, spread it as far and wide to get that information from accountable sources. Kisses to everybody. Virtual kisses.